Hello, everyone. Thank you for taking the time to watch our presentation, and thank you for listening. So this is just a little bit about us. My name is Michelle. I'm a sophomore at Stony Brook University, and I'm a nursing major, and I work Tuesday and Thursday afternoons.
So my name is Devin. I'm a sophomore in SBU, and I'm also a nursing major, and I work Monday and Wednesday after.
Hello, my name is Danny. I'm a sophomore at SBU as well. I am majoring in health science, and I'm pre-med on a pre-med track. I work Mondays 8 to 12 and Fridays 8 to 4.
And my name is Peter. I am also a sophomore at Stony Brook. I'm a biochemistry major on the pre-med track, and I'm here Wednesday and Thursday mornings.
So a little bit of what we do. We do 4 main things here at the clinic, and I'll go over each of them briefly. So firstly, we flag our patients. So we review patient charts for the following day, and we screen them for certified and non-certified conditions to determine if they meet the criteria for the BIA scale. We greet and measure our patients, so we introduce ourselves to the patient, inform them about the scale, and then ask them if they're interested in using it. We also do MOCAs, which are cognitive assessments, and they screen for mild cognitive dysfunction. So we perform the tests on patients to measure language, memory, visual, and spatial thinking. After we conduct the scale measurement on the patient, we will analyze their results with them and answer any questions they have regarding their results. And lastly, we inform them about the nutrition services that we offer at the clinic. So these are the 2 scales that are found in the clinic. One of them is the portable scale that we have on the carts, and the other one is a scale used in the nutrition consults, and this one is a little bit more accurate as it measures each segmental BIA. So what exactly is the tinnitus scale? It's a bioelectrical impedance analysis scale, and it measures body composition by using an electrical current. So based on the resistance, the electrical current is able to determine what type of tissue it's interacting with. So fat mass presents the most resistance, muscle mass presents a little bit less resistance, and bone mass presents the least resistance. There are things that can impact the reading and skew the results. So we recommend that it's best for our patients to be fasted for 3 hours before utilizing the scale. Caffeine and exercise before the measurement can also skew water concentrations. We also always ask our patients if they have a pacemaker or a defibrillator or any other mechanical device that can aid in bodily function. The reason for this is because the scale sends a weak electrical current through the body, and it can cause these internal devices to malfunction. And lastly, our patients should not use the scale if they are pregnant. Now on to interpreting the results. So I'm just going to give a brief overview. On the top, we have the date and the time at which the scale was used, and the results were printed. And then we have the patient's gender, their age, and their height, and we also take off pounds for their clothing weight. Then we have their weight and their fat percentage and fat mass, and this is the amount of fat as a proportion of body weight and total fat mass. Next, we have the muscle, bone, tissue, water, and all other fat-free masses. Next, we have muscle mass. This is the bone-free lean tissue mass. And then we have the total body water, which is the amount of water retained in the body. And the ideal total body water is between 50 and 70%. Next, we have the BMR. This is the basal metabolic rate, and it's the total energy expended by the body to maintain normal functions at rest, like breathing and circulation. And then we have the visceral fat rating. This indicates the amount of visceral fat in the body, and that's the fat that surrounds the organs. So sometimes patients might ask how the tinnitus scale would benefit them. So it keeps track of your muscle mass over time and lets us know if you're atrophying. The dangers of visceral fat, it also educates them about that because it can influence our risk of heart disease, diabetes, stroke, and dementia. It also provides a calorie measurement for a more accurate measurement of needs, and it shows levels of hydration to determine if we are drinking enough water.
So hi guys, as I said, my name is Devin. So I'll be going over the recommended muscle percentage or muscle mass. So the muscle percentage or the muscle mass can be found under the fat-free mass, and it's also highlighted on the left. In order to calculate your muscle percentage, you would take the muscle mass, which right here would be divided by your total body weight, and that would be your muscle percentage. And for male and female, there's different ranges, and same applies for the age range as well. So for those that are like around 20 to 39, the ranges for females are 63% to 75.5%, and for males it is 75 to 89%. And for those that are 40 to 59, for the female range it is 62% and 73.5%. And for males it is 73% to 86%. And for those that are 60 plus, for females it's recommended around like 60% to 72.5%, and for males 70% to 84%. So typically we would say anything above 50% is a good starting number. However, we would still encourage them to gain a little bit more muscle because I'll go over in the next slide. Alright, so why should you maintain your muscle mass or increase your muscle mass? So one of the first reasons being to maintain the ability to function and to perform daily activities like just going to the kitchen and lifting stuff and being independent of your family members and asking them for help. So another benefit is controlling the blood sugar stability. So muscle basically helps you maintain your blood sugar and also reduces your body fat and support your joints and also build strength and stamina. And last but not least, decrease chronic illnesses. So another reason that we should increase or maintain our muscle mass is to decrease chronic illnesses. Sorry. Last but not least, another reason that we should maintain our muscle mass or increase our muscle mass is because we want to decrease that chronic illness chances. So for example, we can decrease the risk of obesity, diabetes, cardiovascular disease, and also keep metabolism and hormone in check. So moving on, we'll go into sarcopenia. So basically what sarcopenia is, it's the gradual loss of muscle mass, strength, and function in individuals, typically those that are like 65 and over. So so who does it like really impact? So as I said before, anyone that's 65 and over, and it can also occur in early stages. So basically after the age of 30, you begin to lose your muscle mass gradually over the years. And so what are like some of the outcomes of sarcopenia? So some outcomes are like increases in fracture, falls, as well as increase in hospitalization, as well as dependents, assistants, and family members for daily tasks and activities. So there are also a lot of misconceptions when it comes to sarcopenia, and many people think that is due to aging, and however that is a part of it. However, there's also different factors that contribute to the sarcopenia. So for example, obesity and malnutrition, like in the lack of protein intake, can also impact or lead to sarcopenia. Moving on, so 1 in 4 patients over the age of 65 fall each year, and for our population, around 1/3 of our population is 65 and over, and so they have like a higher chance of sarcopenia and falls that may result in hip fractures that in like 3 to 4 times. Can lead to mortality, and after surgery after a year, and that the patient might become immobilized as well as require assistance from their family members, as well as lowering their quality of life. Next. So as I said, 1/3 of our patients are older than 65, and moving on. So some of the tips to increase your muscle mass can be just beginning weight training, like lifting weights, TRX, as well as resistant bands and yoga at least 2 times a week. Other tips are making sure that you eat enough. Another tip might be just increasing your protein intake every day. Most people should eat around a minimum of like 0.6 grams of protein per pound of body weight or desired weight. Another tip is just working with us to determine the proper amount of protein you can intake and discuss if you have any kidney issues. And also, as a reminder, it is important to discuss the limitations with your doctors before starting an exercise routine. So I'll be also going over the basal metabolic rate, which is your BMR. So the BMR can be found under the bone mass. So and they're typically measured in kcals. So basically, these are the calories you burn at rest. So and it accounts for your natural body processes such as circulation, breathing, etc. So any movements in general will increase that caloric intake value as well. So, and along with your calorie needs, there will also be a symbol to show how efficiently your body is burning calories. So the plus sign indicates that your body is highly efficient at burning calories. Zero means that your body is average at burning calories, and the negative sign just indicates that your body is slowly at burning calories. So with this, the increase in muscle mass can also help you increase that BMR rate, and you can eat more of that. So how to determine your recommended calorie intake using BMR? So the first step is to determine your activity level. So activity levels can be in different ranges, and right below we can see that if you have little to no exercise, we typically the activity level will be 1.2, and for moderate exercise it's 1.375, and for very active, if you play any sport or like work out like 6 to 7 days a week, it's multiplied by 1.725. And if you are extra active, maybe that you're like going to the gym every day and you also have like a physical job, maybe you're like a firefighter or you're like a construction worker, it would be 1.9. And if anyone has Apple Watches or any fitness trackers, it also will tell you how many active calories you burn throughout the day as well. So moving on, for step 2, just multiply the BMR with your activity levels. So we have 3 levels. So in order to maintain your weight, just multiply your BMR with your activity level, and that will be the amount of calories you should eat. And for the next one, and to lose weight, you would times your BMR with your activity level, but subtracting 500 from that if you want to lose weight. And in order to gain weight, you would take your BMR multiplied by your activity level and plus 300 and subtract 500 in order to gain weight. So if you struggle with weight management or calorie consistency, we recommend working with our registered dietitians to help you better achieve your goals.
For this portion, we're going to be going over some things more related to fat. So a word that's thrown out a lot is BMI. That's something a lot of people have on their minds. And BMI is a measurement, it's a ratio between your height and your weight. Now that's very useful for screening because a lot of times a high BMI would be indicative of higher weight. However, it doesn't tell the full story because two people could be of the same height and the same weight but have a much different composition in terms of how much muscle they have or how much fat they have. So BMI doesn't always tell the full story. So that is where something like fat percentage and fat mass comes in. So that is a measure of how much of your tissue is fat tissue. And you can see that the recommended ranges for women for the most part tend to be with the lowest bar set in the low 20s, low to mid 20s, with the highest being in the low to mid 30s. And for men, that being in the low teens, about 8% to 13% being the low range depending on age. And for the most part, depending on age, being in the low to mid 20s there. Now, it's important, certainly, to keep your body fat percentage in range because body fat is associated with a whole slew of comorbidities that ideally would be avoided, such as type 2 diabetes, high blood pressure. Blood labs often can be thrown off by obesity, osteoarthritis, sleep apnea, digestive problems, mental illness, cancer, just a lot of negative things associated with a high fat percentage that, of course, would be avoided. And cancer risk is also increased with a high fat percentage, as women with 30% body fat or more and men with greater than 25% body fat are at an increased risk for cancer. And even mortality, there's decreased life expectancies and decreased quality of life with higher fat percentages. So definitely one that would be kept low. So to actually achieve a lower body fat percentage, it's recommended to consume foods that are lower in sugar, especially added sugar. And prioritizing sleep, stress management, self-care are all, of course, important to maintaining a good fat percentage, and increasing the intake of fiber along with fruits, vegetables, foods like beans and legumes and nuts and seeds, and whole grains as well, while reducing the consumption of refined grains. So whole grains over refined grains can help to decrease fat mass. And of course, working with a dietitian to come up with a strategy of how to best decrease your fat percentage individually is extremely helpful. And along with fat mass and fat percentage, we also look at something called visceral fat. So visceral fat is the certain type of fat that is found in your abdomen, around the stomach area that surrounds your organs. And ideally, a visceral fat rating would be between 1 to 12, as scoring of visceral fat higher than 13 can increase the risk of heart disease, type 2 diabetes, Alzheimer's, stroke, cancer, and many other life-threatening illnesses. And visceral fat can be reduced by the methods of, quality exercise, a healthy diet. Intermittent fasting has been shown to be helpful with visceral fat, and of course things like good sleep quality and reducing stress. So to just take a closer look at visceral fat, there are two types of fat. Subcutaneous, meaning under the skin, that's what we tend to see, that's what's more towards the surface. But as you can see here, visceral fat is what's deep inside of us surrounding our organs. Now, visceral fat does connect to cancer. Now, within our WTC population, cancer is the third most prevalent condition, behind only GERD and chronic rhinosinusitis. And as we can see from studies with our friends, the mice, more obese mice had increased growth factors, tended to have hyperinsulinemia and hyperleptinemia. We'll go over what all those are, but all of those do increase the risk of cancer. Now, how do they do so? So, on the one hand, visceral fat, the tissue, releases a hormone called leptin. Now, leptin normally is the hormone that helps us satiate our appetite. However, when you have chronically high leptin, it can be used as cancer cells to help them directly grow as a growth factor. And it can also stimulate something called angiogenesis, just meaning that it's helping the tumor get blood flow. And of course, it needs blood to grow. And excess visceral fat can also cause hyperinsulinemia. Visceral fat releases molecules called adipokines. They're just inflammatory molecules that can decrease our liver and muscle sensitivity for insulin. Now, the problem with this is that this leads to a greater bioavailability of something called insulin-like growth factor 1, or IGF-1. And with that being a growth factor, our cancer cells can use that to continuously grow. And insulin in and of itself can be bad because it can help cancer cells escape our cells' methods of killing a cancer cell. A cancer cell, often when mutated, normally would go through a programmed cell death, but insulin can help cancer cells escape that, and it too can be used to help them directly grow by increasing the receptors for sugar. It helps our cancer cells get more sugar. So you can see visceral fat is basically helping the cancer cells get blood flow, helping the cancer cells get more sugar, and helping them escape our body's ways of killing the cancer cell before it starts to grow. Now, of course, dietary intervention and lowering our visceral fat can be extremely helpful in reducing this risk. Lower visceral fat and dietary intervention would improve glycemic control, meaning we're not as worried about high insulin levels and not as worried about high sugar helping the cancer grow. Decreased visceral fat, of course, so we're not pumping out as much leptin to help the cancer cells grow. And decreased inflammation, just because inflammation can worsen a cancer prognosis. So visceral fat and lessening it as much as we can is always helpful for reducing the risk of cancer.
So I'm going to touch on visceral fat and cardiometabolic health. This first figure kind of gives an overview of how subcutaneous adipose tissue and visceral adipose tissue indirectly affect insulin resistance. So basically what happens is the tissues cause an excess of lipids, which can, in some cases, cause lipotoxicity. This affects the liver and muscle and causes insulin resistance. Visceral adipose tissue is also prone to inflammation and inflammatory cytokine production. This also contributes to impairment in insulin signaling. Expansion of visceral adipose tissue in the liver and muscle can also result from the limited expandability of the tissue due to the properties of its matrix and its capacity for capillary growth. There have been many clinical studies that have significantly expanded our understanding of non-modifiable and modifiable risk factors, with the development of cardiovascular disease and related mortality being associated with a high body mass index, arterial hypertension, and increasing concentrations of glucose and cholesterol. The current consumption of high-calorie foods and decreasing activity have made obesity and type 2 diabetes the leading risk factors for coronary artery disease progression and mortality. Additionally, I found that many studies prove that using the ratio of waist circumference to hip circumference was found to be more effective than BMI for assessing the risk of metabolic and cardiovascular complications. This diagram gives us an overview of the key therapeutic targets beyond just weight loss to assess the response of sedentary, viscerally obese patients to a lifestyle modification program. So we can see in this diagram the person, when put into a lifestyle modification program with regular exercise and physical activity, caused a decrease in cardiovascular disease and just an overall improved metabolic risk profile.
All right, so next let's talk about how visceral fat can affect the brain. So specifically, studies have shown that increased visceral fat can be a risk factor for cognitive decline. So it can possibly change the way your brain cut. Yeah. I'm just going to redo this. All right. Resume. All right, let's talk about how visceral fat affects the brain. So, studies have shown that increased visceral fat can be a risk factor for cognitive decline. So, I'm going to hit you with some studies here and some graphs, so bear with me. This one study has found that, as you can see, as visceral fat increases, the global cortical thickness decreases at a significant rate. So what does that mean? Basically, your cortical thickness is the thickness of your cerebral cortex, or that outermost gray matter of the brain. What that does, that's responsible for your cognition, your sensory function, your motor function, etc. So many studies have also seen that a decrease in cortical thickness is associated with cognitive decline. All right, another study here has shown that high visceral fat is significantly associated with increased white matter lesions. So the white matter is the more inner most matter of your brain, and that contains a bunch of nerve fibers which are responsible for the communication with the different parts of your brain. Increased in the amount of lesions in this area of the brain can interrupt those tracts and decrease the ability of your brain to communicate within itself. And it can lead to problems in balance, walking, and even memory. Speaking of memory, high visceral fat is also associated with decreased hippocampal volume. The hippocampus is part of your limbic system in your brain, and basically that's responsible for short-term and long-term memory. So if you have decreased hippocampal volume, there's a chance it can affect your memory in a negative way, and that leads to Alzheimer's disease, or it could lead to Alzheimer's disease. Studies show that people with Alzheimer's disease, as you can see in this graph, have a higher hippocampus atrophy. So if visceral fat increases hippocampus atrophy, there's a possibility that it can lead to Alzheimer's disease or other memory problems in the future. All right, so just to note, correlation doesn't lead to causation, so there's a possibility that all of that can be caused by something else, another confounding variable, but it's good to note that. All right, so moving on, just some tips and tricks to improve your visceral fat. Avoid sugary drinks like soda. Water is always better. Increase your exercise if you can. The AHA recommends 150 minutes of aerobic exercise or strength training per week. Reduce your smoking or even stop smoking, and get a good night's rest. Let's go over some scale stats. So out of the about 40 patients in the clinic per day, we flag about 15 to 20 patients. Note that some of them are no-shows, or they reschedule, or they were discharged even before being seen. But we try to see as much flagged patients as possible. And then Mondays are mostly V1 patients, meaning it's their first time coming into the clinic. So we cannot really flag them because we don't have that much medical history prior. And just another thing is the scale visit started in August 2022, so we're pretty new to this. All right, so looking at some averages, you can see the averages right here. Just to note, above a BMI of 30 is considered obese. Like Peter said, though, that's not the best representation. Fat percentage depends on the age, but generally above like 33% is considered to be high. But you can see here our average is 31. Average BMI is 33. Visceral fat is average is 17. The ideal range for that is 1 to 12. So we can see how our members compare to that. Our water percentage average is 47. Ideal for men is 50 to 65. And then ideal for women is 45 to 60. And the average weight is 106 kilograms. All right. So as we can see, about 78%, according to BMI, about 78% of our patients are considered obese or above the BMI of 30. For visceral fat, about 70% of our patients have a visceral fat above 15, which is considered to be high. And again, that is the fat surrounding your organs. For fat percentage, about 60% of our patients have a fat percentage of 20 to 33, and about 39% have a fat percentage above 33%, which is considered unhealthy. And for water percentage, about 80% of our patients have a water percentage of 41 to 50, and about 15% have a water percentage above 50. So most of our patients are under that 50%. Moving on, some goals for the future. We would like to have all the patients use the scale. It would be beneficial for all our patients to see what their body composition is, and hopefully we can include that in the vitals part of the visit. Another goal is to have all the other clinic workers trained to use the scale, just in case, because we don't have that many nutrition assistants here. So if other workers could help us out, then we could have more patients use the scale in the future. And also just to further educate our patients on the importance of nutrition and how we can deal with that. All right, and for our nutrition services, we offer one-on-one counseling. We have 2 dietitians here, Amanda and Katie. They're wonderful at what they do, and they offer counseling in here, right here at COMAC, or they can do telehealth Monday and Fridays, 8 to 4. We also have a website which contains a bunch of resources. We have recipes, videos just like this one, and even a course to help you out. And then we also have monthly webinars that our dietitians do, and they're a recording just like this and can be attended live. And if you guys have any further questions, you can always reach out to our 2 dietitians, Katie and Amanda, and their numbers are right here. And other than that, thank you. We hope you enjoyed this presentation. We hope you learned something new from it. And we can't wait to see you in your future visits here.